The dog noticed her before the man did. That was the thing nobody talked about afterward. Not in the incident report, not in the administrator's carefully worded memo, not in the hallway conversations that stopped whenever Megan Farris walked past. Everyone focused on what she said, what she did, how she stood in that doorway, with her arms crossed and her voice so steady it made the charge nurse step backward. But the dog saw her first, and that, if you paid attention to the right things, was where the whole story actually began. Megan had been a nurse for 6 years. 4 of those years were spent in a trauma bay at St. Augustine Medical Center in Roanoke, where she learned that people in crisis communicated in a language that had nothing to do with words. A grip tightening on a bed rail. Breath held 3 seconds too long. Eyes that tracked movement near the door like something terrible was always about to come through it. She had learned to read that language the way other people read faces. Automatically, without thinking, the way you recognize a friend's silhouette from half a block away. She transferred to Hargrove Regional's behavioral health unit 14 months ago. Her mother thought it was a step down. Her mother was wrong. The unit occupied the 4th floor of the East Wing, separated from the rest of the hospital by a set of double doors that required a badge swipe and, on bad nights, a particular kind of patience. It was quieter than the trauma bay, but heavier in a different way. The trauma bay had noise and speed, and the particular electric urgency of someone whose body was failing. The behavioral unit had silence, and silence was harder. Silence meant the crisis had already happened. What was left was the person standing in the rubble of it. Megan liked the rubble. She was good at rubble. She came on shift at 11 on a Tuesday night in February when the parking lot still had black ice at the edges and the heating system in the East Wing made a sound like someone dragging furniture across the floor above you. She poured coffee she wouldn't finish, checked the board, and picked up the handoff notes from Delgado, who was already pulling on his coat before she'd finished reading. Room 412, he said. New admit. Came in around 7. Ranger Swick? Wait, no. He corrected himself, glancing down at the folder. Staff's been calling him that. Actual name is Donald Swick. 44, retired Army Ranger. 2 tours Afghanistan, 1 Iraq. Combat injury to the left leg, partial nerve damage, took a medical discharge 8 years ago. Presented tonight with acute dissociative episode in the parking lot of a Walgreens on Clement Street, Bistander called it in. Megan looked up. Alone? His dog was with him, Belgian Malinois, about 6 years old, named Cedar. She waited. They're both in 412, Delgado said. I know what the policy says. But when the intake team tried to move the dog to the holding area downstairs, Swick, he paused, searching for the right word and not finding it. It wasn't good, Megan. They backed off. Who authorized the dog staying in the room? Nobody authorized it. Everybody just stopped arguing about it. He shrugged into his jacket. Dr. Vance signed off on a hold through Thursday. Psych eval tomorrow at 10. But tonight he hasn't spoken since they got him up here. Hasn't eaten. Nurse who did the intake assessment said he sat in the corner of the room for 40 minutes before he'd get on the bed, had his back against the wall the whole time. Megan nodded slowly. Cedar's a certified service animal, Delgado added, like he was offering her something. Papers are with the intake folder. ADA compliant. The animal coordinator on days kicked up a fuss, but she went home at 5, so it's my problem now. It's your opportunity, he said, without irony, and left. She stood at the nurse's station for a moment after he was gone, looking at the name on the board. Swick D. 412. Then she picked up the intake folder and walked down the hall. She stopped outside the door and looked through the narrow vertical window before going in. That was habit, not procedure. The procedure said announce yourself, enter, begin assessment. The habit said look first. See what you're walking into before you change it by walking in. Donald Swick was on the bed, sitting up, back against the headboard. He was a large man, not the way that word is sometimes used carelessly, but genuinely, physically large, the kind of large that comes from years of carrying weight and not putting it down. His left leg was extended straight on the bed. His right knee was bent, arm resting on it, hand loose. He was wearing the hospital issue gown over what looked like his own gray thermal shirt. He wasn't looking at the door. He was looking at the dog. Cedar was lying on the floor directly beside the bed, close enough that his side was pressed against the frame. He was facing the door, ears up, still in that particular way that working dogs go still. Not relaxed still, but watchful still, the kind of stillness that contains a question. Cedar was looking at Megan. She held very quiet. She didn't knock yet. She just stood there, and she let the dog look at her, and she looked back at the dog, and she thought, okay, I see you. She knocked twice. Light. Mr. Swick. I'm Megan Farris. I'll be your nurse through the night shift. I'm going to come in. No answer. She hadn't expected one. She opened the door slowly, stepped in, left it open behind her the width of one hand. Cedar's ears moved. He didn't stand. He tracked her from the floor with that same question in his posture. Not threat, exactly, but evaluation. Who are you? Why are you here? What do you want with him? Megan stopped about 4 feet inside the door. She didn't approach the bed. She looked at Donald Swick. His eyes had moved to her. Dark eyes, very still, set in a face that had seen a great many things and had learned not to react to most of them. There was a quality in that face that she recognized and couldn't name. Not hostility, not fear, something more like the aftermath of both, the particular flatness that comes when a person has been afraid and angry for so long that the feelings have stopped making faces. I'm not going to take the dog, she said. It was not what she had planned to say. She had planned to say something about the assessment, about the night routine, about what to expect. But standing in that room, looking at those two faces, the man's and the dog's, both watching her with the same wary stillness, that was the sentence that came out. Donald Swick looked at her for a long moment. Then he looked back at Cedar. Cedar had dropped his chin to the floor. The question in his posture was still there, but something in it had shifted. Not gone, just quieter. Megan pulled the chair from the corner of the room, set it about 6 feet from the bed, and sat down. She opened the intake folder on her knee. I'll need to do a quick vitals check in a few minutes, she said, and I want to go over a few things with you. But there's no hurry. We can sit. They sat. She didn't fill the silence. That was the first thing they taught you, and the last thing most people actually learned. That silence was not a void you were obligated to fill. That sometimes the most therapeutic thing you could do was hold the quiet steady and let the other person decide what to do with it. Most nurses talk too much. Most people talk too much. Megan had learned to be very comfortable with not talking. The heating system made its furniture-dragging sound somewhere above them. After about 4 minutes, Donald Swick said, "He's not supposed to be in here." His voice was low, rougher than she'd expected, like a voice that hadn't been used much recently. The paperwork's in order, Megan said. He has every right to be here. A pause. They said earlier. I know what they said earlier, she said. I'm the nurse on duty tonight. The paperwork's in order. Cedar stays. Another silence, longer this time. Cedar's tail moved once against the floor, a single slow sweep, and then went still again. Donald Swick looked at her. He picked you, he said. It wasn't a question exactly, more like an observation, delivered with the mild surprise of a man who had learned to notice the things animals noticed, because in certain places and circumstances, animals notice things first. I think he's still deciding, Megan said. The corner of Swick's mouth moved, not a smile, something smaller than that, and older. She did the vitals check. His blood pressure was elevated, but not dangerously so. Pulse steady. He allowed the blood pressure cuff, allowed the pulse oximeter, answered her basic orientation questions, name, date, location, in the same low, careful voice, like a man measuring out words by weight. He did not answer when she asked about the episode in the parking lot. She didn't push. Cedar watched all of this from the floor. When she reached across Swick to check the IV line, Cedar's head came up. She moved slowly, deliberately, announced what she was doing before she did it, kept her body language loose and unhurried. Cedar watched, and when she stepped back, Cedar's head went back down. He's good at his job, she said. He's better at it than most people I've worked with, Swick said. And then, after a moment, like the sentence surprised him, human people. She made a note, said nothing. She checked in on the other rooms, 2 other patients on the unit that night, both stable, both asleep, and came back to the nurse's station. The unit was very quiet. The east wing heating made it sound. Somewhere far below, an ambulance bay door opened and closed. At 1:17 a.m., Megan's shift supervisor, a man named Patterson who wore a lanyard with a photo of his dog on it and who managed, somehow, to be simultaneously well-meaning and exactly wrong about nearly everything, came up to the 4th floor. She saw him coming and felt the particular kind of tired that wasn't about sleep. The 412 situation, he said. It's not a situation, she said. It's a patient. The animal coordinator flagged it when she came back on for a half shift. There are liability concerns. The animal coordinator went home at 5, Megan said. And the dog has current service animal certification, handler authorization, and full ADA compliance documentation. It's in the intake folder, which I reviewed, and which is correct. Patterson looked at her. He had the expression of a man who had prepared for an argument and was mildly frustrated to find she'd already diffused it. The other patients, room 410 is asleep. Room 416 has a documented fear of dogs, which is noted in her chart, and Cedar has not left 412. She paused. Is there something else? There was something else. She knew it by the way he didn't leave. Administration is going to ask in the morning, he said, whether the dog being permitted to stay affected the patient's care. It enabled the patient's care, Megan said. Without Cedar in the room, Mr. Swick would not have been accessible for assessment. With Cedar in the room, he cooperated fully, his blood pressure stabilized over the course of the first hour, and he communicated voluntarily for the first time since admission. I'll have that in my notes. Patterson nodded. He still didn't leave. You know this is going to be a thing in the morning, he said. I know, she said. Hartley is going to. I know what Hartley is going to do, Megan said. I'm not worried about Hartley. I'm worried about my patient. Patterson left. She went back to 412 at 2 a.m. for the standard check. Cedar was on the bed now. She hadn't heard it happen, but there he was, pressed along Swick's left side, chin on his knee. Swick was still sitting up, but his shoulders had dropped 2 inches from where they'd been at 11. His breathing was slower. Cedar looked at her when she came in. She did the check quietly. When she was done and moving toward the door, Swick said, without looking up from the dog, "You were Army." She stopped. "Your hands," he said, "the way you moved the IV line. You've worked around people who flinch." She had been Army. 4 years, military nursing, 1 tour at Landstuhl Regional Medical Center in Germany, the place where the serious ones came. She hadn't put it on the name tag. It wasn't on anything he could have read. "Yes," she said. He looked at Cedar, thought so, and then, "Thank you for not taking him." "You don't have to thank me for following the law," Megan said. "Most people don't follow it," he said, "when it's inconvenient." She thought about that in the hallway. She thought about it at the nurse's station at 3 in the morning with cold coffee and the heating system and the particular quality of a winter night in a hospital when the world has contracted to this. Just the rooms and the people in them and what they needed and whether you could give it. At 6:45 a.m., 20 minutes before day shift arrived, Hartley came. Hartley was the behavioral unit administrator. She was not a nurse. She had a master's degree in healthcare administration and opinions about liability that she delivered in a particular tone, smooth, regretful, as though she were reporting something unfortunate that was entirely out of her hands. She walked into the unit at 6:45 with a man from risk management whose name Megan had already forgotten and did not try to remember. "I understand there's been a protocol deviation regarding the animal in 412, Hartley said. "There hasn't been," Megan said. She had her notes. She had the intake folder. She had spent the last 20 minutes making sure she had everything in order because she had known, since 11 p.m., that 6:45 was coming. The policy states that non-certified companion animals are not permitted in patient rooms, Megan said. Cedar is a certified psychiatric service animal under the ADA. He isn't a pet. He isn't a companion animal. He is a medical assistive device, functionally, and Mr. Swick's right to have him present is protected under federal law. Section 36.302 of the ADA regulations. I can print it for you. Hartley looked at the risk management man. He was looking at his phone. There were other patients on the unit. Room 410 did not encounter the dog. Room 416's chart documents a fear of dogs. Cedar did not leave 412 at any point during my shift, which is documented in my nursing notes. No patient was exposed to the animal without consent. The intake process, the intake team's decision to back down from forcing separation was the correct decision, Megan said, and if it had gone the other way, Mr. Swick's condition would have deteriorated significantly. He was in acute dissociative distress on admission. Forced separation from his service animal in that state could have constituted a serious harm event. I'm prepared to document that assessment if it's needed. Hartley was quiet for a moment. You should have called me, she said. The smooth regret was still there, but something underneath it had shifted, hardened slightly. It was 11 p.m., Megan said. The situation was managed appropriately within existing protocols and federal guidelines. There was no clinical indication to escalate. I'm the administrator, and I'm the nurse, Megan said, on the floor, at 11 p.m. with the patient. The risk management man looked up from his phone. Hartley said, "This conversation isn't over." "I know," Megan said, "but I have a shift handoff in 15 minutes and I need to brief the day team on Mr. Swick's status." They left. She stood at the nurse's station for about 30 seconds after they were gone. Her hands were very steady. She noticed that, the way you notice weather, without judgment, just observation. Day shift came in. She briefed them on Swick, on Cedar, on the stabilization overnight, on the 10 a.m. psych eval and the things she'd observed, the way he responded to slow movements, the way Cedar monitored his breathing, the 3 times during the night she'd heard him wake, and the way the dog had already been moving before the sound stopped. "Stopped," she said. "Watch the dog. Cedar will tell you what he needs before he does." She drove home in the gray February morning with the heater running and the radio off, and the feeling she sometimes got after a night like that. Not triumph exactly, not satisfaction exactly. Something quieter, the feeling of having done the specific thing that was needed, in the specific moment it was needed, without flinching away from it. She slept 4 hours. When she woke up, there was a message from Patterson. "Administration wants a meeting at 3. Bring your documentation." She brought everything. The meeting was in the conference room on the 2nd floor. Hartley, Patterson, the risk management man, and a woman named Dr. Ellison from the patient rights office, who had introduced herself as being here to facilitate. Megan sat across from them with her folder and her notes and her nursing record from the previous night and the printed text of the relevant ADA regulations. Hartley began by saying that the hospital had an obligation to ensure consistent application of policy. Megan agreed and noted that consistent application of policy required that policy not violate federal law. The risk management man said that the concern was not about the law but about precedent. Megan said that the precedent she was concerned about was nurses overriding the ADA-protected rights of patients because it was administratively convenient. Dr. Ellison said mildly that both concerns were valid. Hartley said that Megan had, essentially, made a unilateral decision that deviated from established intake protocol without authorization. Megan said, "I followed the law. I provided appropriate care to a patient in acute psychiatric distress. I documented everything. If the intake protocol requires nursing staff to violate the ADA, then the intake protocol needs to be revised, and I'd like to be involved in that process." There was a silence. "You'd like to be involved," Hartley said. "Yes," Megan said, "because I'm going to be the one doing it again the next time it comes up." Another silence. Longer. Dr. Ellison was writing something on her notepad. The risk management man was looking at Megan with an expression that she could not read precisely but which seemed to contain, underneath its professional neutrality, something that might have been faint respect. "I want to be clear," Hartley said. "This hospital takes patient rights seriously." "I know," Megan said. "That's why I work here." The meeting ended 40 minutes later without a formal resolution, which was its own kind of resolution. Nobody was disciplined. Nobody was vindicated. The room emptied in the particular way rooms empty after conversations that nobody is entirely willing to claim. Dr. Ellison caught her in the hallway. "For what it's worth," she said quietly, "the patient rights review will support your position." "I know," Megan said. "Hartley's going to make your life difficult for a while." "Hartley makes everyone's life difficult," Megan said. "That's not new." Dr. Ellison smiled. A small, real smile, the kind that doesn't perform anything. "You knew all of it. The law, the documentation, the protocol gaps. You had all of it ready." "I knew at 11 p.m. that the 6:45 conversation was coming," Megan said. "I had time to prepare. Most people wouldn't have." Megan thought about Cedar looking at her through the narrow window. Thought about the way Swick's shoulders had dropped 2 inches over the course of 1 hour when nobody took the dog away. "Most people aren't paying attention to the right things," she said. 3 days later, Donald Swick was discharged. His psych eval had gone better than the team expected. Cedar had been permitted to remain in the room, which Dr. Vance had noted made a measurable difference in Swick's participation and self-disclosure. He had a follow-up with the VA. He had a referral to an outpatient PTSD program that had a service animal accommodation policy because Megan had specifically researched which programs in the region did. On his way out, Swick stopped at the nurse's station. Megan was not on duty. He asked the day nurse for a piece of paper and wrote something on it and said, "Give this to Farris." When she came in for her shift that night, the note was on her locker. It said, "Cedar says thank you. So do I." DS below that, in smaller writing. He doesn't usually say that to people. She read it twice, folded it, tucked it in her jacket pocket. She poured coffee she probably wouldn't finish, checked the board, picked up the handoff notes. The east wing heating made it sound above her, like furniture being moved in a room no one was using. She walked to the double doors, swiped her badge, and went through them into the unit, and the quiet there was the kind of quiet that had weight to it, not empty, but full of the people in the rooms and what they were carrying. All the things that had happened before tonight that had led them here, to this floor, to this particular version of their lives. She was good at this. She had always been good at this. She got to work.